Hey guys! I'm so excited to invite you and welcome you to our live event here. Ruth and I are here to talk about all things semaglutide and anything else that you want to chat about too. If you think of any questions while we're here, type it in. Elsie's behind the screen there. She's going to let us know what questions are coming through so that we can address any concerns you may have. Before we get started, I'll introduce myself. I'm Kristina, or KP, depends on who you ask around here. I am the clinical team leader and medical assistant. That means I work really closely with our entire medical team, our MD, Dr. Green, our nurse practitioner, Ruth, our PA, Jade, and our fabulous RN, Rebecca. So I am kind of, the liaison between all of the medical things and you guys here so that we can give you the best experience possible. Here's Ruth.
And I'm Ruth. I'm a family nurse practitioner and have worked as an NP for over 20 years. And I'm here to show experience with the semaglutide and help people be their healthiest.
Yes. So we are super excited to be here and answer questions today. We have our Semaglutide program here at Rêvée. For those of you who maybe aren't on the program and just want like a general rundown of the information, let's talk about what is semaglutide. What is it and what does it do?
Right. Semaglutide is a medication that's very similar to a particular hormone that our body produces after we've eaten. Kind of tells the brain, okay, I'm done, I don't need to eat anymore. So the semaglutide is kind of being given that from an outside source, but does the exact same thing. It also helps balance blood sugar so that you're not getting the highs and lows of hypoglycemia and getting the hangries and that kind of thing. It also slows down digestion, so food stays in the stomach for a longer period of time. So in essence, people tend to eat less because they feel satisfied for a longer period of time. Works on the brain to decrease cravings and all that other food chatter. So it's just a really nice extra tool that people can use in addition to healthy eating and exercise to become their healthiest.
Yeah, absolutely. It's been an amazing tool. We've seen people be less hungry, eating less when they are hungry, giving them the ability to have more control over their food intake and their choices. And we're just not miserable while we're doing it. I know I've had my dieting seasons in the past where I've just been so hungry and just so miserable and just not feeling great. And this takes that away a little bit. It allows us to have a little bit more control over what we're doing during our weight loss journey.
Yeah. One of the questions that was submitted prior to the live Q&A is semaglutide a semaglutide salt?
That is actually a really great question, and I'm really thankful that one of our followers submitted that one. There's a lot of misinformation out there right now, and it's kind of controversial. They're using a lot of buzzwords and getting people really worked up on this topic. Semaglutide itself is a molecule delivered to the body. It has to attach to something to be delivered. So there are prescription versions under name brands of semaglutide that are attached to a base. The non-prescription versions that are compounded are attached using a salt, a sodium chloride. That gets into your system, whether it's the base or the sodium chloride, and that semaglutide molecule detaches from its delivery system to be delivered to your body. I know this is really sciencey, so just bear with me here. But basically, the end of it all is that semaglutide is getting into our system and it's being delivered effectively, regardless of whether it's attached to a base or to a salt.
Right. It basically does the same thing once it's in the body.
Mm-hmm. So I hope that answers that question. I know there's a lot of misinformation out there, and we're happy to further dive into anything else that you may have in regards to that.
Okay, so the next question is, do you have any recommendations on improving fatigue?
Yes. Actually, about 11% of patients in the studies for semaglutide at its maximum dose experienced fatigue. In those studies, fatigue tended to be transient and go away. I think a lot of the complaints about fatigue with people on semaglutide may be related to the fact that they're eating a lot less, taking in a lot less calories, and your body needs a certain amount of nutrients in order to work. It's like putting gas into a car. Some people may be running on much less than a full tank. So, a couple recommendations that I have is making sure that you're getting plenty of protein, because that's the building block. We also need good carbs. Carbs are those basic energy sources. So, whole grains, healthy fats, fruits, vegetables, staying away from the processed and sugary things is really important. Increasing exercise can give a boost of energy, and then B12 and lipo shots can certainly boost energy as well.
Yes, I was going to say we have lipo shots here, lipotropic injections. They are a combination of B vitamins, B6, B8, B12. There's also some amino acids in there too. Really, they're helping the body function optimally and can help with the fat burning process as we're, on this journey. But it does help give us a little bit of a sustained energy boost. Nothing like an espresso shot where we're bouncing off the walls. There's no highs and lows, just generally feeling a little bit better and having that sustained energy.
Great. Another question is, how long does it take to start feeling the effects of semaglutide?
That's a great question. I think it's different for every person, but I'll let Ruth weigh in here. I feel like I talk a lot.
I think most people really find, that they're having effects within the first week. I don't think I've had one or two patients that it's taken a little bit longer. And again, like KP said, it varies for everybody, but I think it's usually a pretty quick kind of thing.
Mm-hmm. And we do start on a lower dose and build up on a monthly basis. So some people at that low dose, their body is like, all right, come on, give me a little bit more. So if it's been a couple weeks on that lower dose and we're just not seeing the effects yet, we want to know about that, because we're going to work along with you and change our plan. We're going to make adjustments so that we can get those results a little bit sooner. Like Ruth said, we usually have people seeing results in that first week or two, definitely within that first month.
Great. Another question is, can you eat what you want to eat on semaglutide?
Short answer, yes. You can eat whatever you want. You may not feel great depending on what you're eating. If you have certain food choices, I know for me, anytime I had something like really greasy or fatty, nausea triggered like immediately. So yes, you can eat what you want, but you may not feel great eating all of it.
Right. And also, if you eat what you want and how much you want, sometimes your body will tell you, that didn't work out so well. I found, and I haven't heard this from other patients, but it's sort of like I can take a couple bites of certain food and then it's almost like an aversion kicks in.
I've actually heard that from a lot of patients' feedback that, if they're having a craving for ice cream or something like that, they might take a bite or two and that does it. They're like, done, don't want any more, just push it away. So.
And does that ring true for alcohol as well?
Some people have definitely reported having less of a desire to drink alcohol. If you have a nightly glass of wine, maybe you just don't really want that anymore. Have you heard that, experienced
I've heard that from a lot of people. People especially who are used to having a couple glasses of wine just aren't interested in it anymore. So that's another benefit if that's one thing you want to kind of cut out of your lifestyle.
Extra calories too.
Yes, yes.
Okay, great. Another question is, how much weight can I lose?
Ooh, that's definitely a patient-specific one. But generally what we see is about 6% of body weight loss in the first 3 months, and 11 to 12% loss in about 6 months. So if you know your weight, you can do some quick math there and kind of figure that out. But that's compared to when we're just dieting and exercising, the average is about 2% of weight loss through that entire time frame. So 12% with an added tool like semaglutide, definitely gives us that extra push.
Yep.
Okay, and then what happens when you're on the semaglutide program and you reach your goal weight?
That, I think, is an individual decision. You know, the only real study that has been done on what happens when you discontinue semaglutide is, and it's been done in people with a BMI 27 and longer, is that people are followed over time. On average, people will tend to gain some weight back. On average, that tends to be about 2/3 of their original weight. However, again, very individually specific. If this is used as a tool in addition to healthy diet and healthy exercise, some people may not gain much weight back at all. It's going to depend on how people continue their maintenance when they're done. But I think most people have the goal of eventually discontinuing the medication.
I think a lot of us struggle too with losing that weight initially, and we find maintaining that to be a little bit easier. So this can be a tool that helps to get us to our goal weight, and then once we're there, if we come off of it, we can hopefully maintain a little bit easier. With obesity, if we're talking about obesity, that is considered a lifelong disease, basically. Right. So for patients who struggle with that, semaglutide can potentially be a long-term solution to help maintain that. We do have patients who plan on being on this more long-term. We do have patients who plan on meeting their goal weight and discontinuing. We have a couple options on doing that. There's no scientific reason that you have to taper off. You can stop. You can just stop. Doesn't hurt anything. Your body will naturally process that medication out and you'll be back to baseline. We can also taper that dose back down and kind of slowly come off of it to help maybe minimize cravings coming back as quickly, give us chance to establish more lifestyle changes in maintenance mode. And then we have patients who plan on doing this for, a long-term solution as well. It's really individualized, and we're going to work with you to figure out what the best option is moving forward.
Great. When can I expect to see results?
Great question.
I think just about every patient has seen at least some kind of result within that first month. And for some patients, it's been quite a large result.
Mm-hmm. Yeah, I am happy to see 0.5 pound to 1 pound a week lost in that first month. Some people are disappointed if they've only lost 4 or 5 pounds, but it's actually a really, really great start, and it's sustainable. So seeing those, slight drops in that first month is amazing, and then it usually kicks up from there. But we should be seeing something happening in that first month.
Great. Do either of you have any personal anecdotes about your experience on semaglutide?
Yeah, I think my experience has been overall very positive. I've lost about 20 pounds. I'm kind of close to where I want to be, where I feel well. Haven't had a lot of nausea. I've had a few bouts of constipation. I've had a real positive feedback. I like to have a glass of wine or two at night, and that habit has really fallen by the wayside, which I'm very happy about because that may have contributed to a lot of my weight gain. Sometimes I get a little bit concerned about my total lack of appetite. I'm one that tends to try and push myself to eat, even though I don't feel much like it, just to make sure that my body is fueled the way it needs to be fueled. But other than that, it's been a real positive experience.
Yeah, I did the Semaglutide program for about 3 months. So I've been one of the people who have done it, gotten to my goal weight, and then come off of it. So while I was on the program, I definitely had decreased hunger. My nausea really just kicked up when I went too long without eating. So it was something that I tried to be mindful of, keeping snacks kind of on hand just in case. And I also continued to work out during my time on the program, was, able to continue with my progress in the gym. After I came off, my hunger came back full force, and I did gain a little bit of the weight back, probably about 5 pounds. And I'm at a point now where I'm looking at, maintaining where I'm at and being happy in this kind of 5-pound fluctuation space. But it's been a really positive experience for me. I think I definitely struggled with cravings before, and I didn't really have much of cravings when I was on the Semaglutide program. So I've been really, really happy with it. It's been a good tool.
Okay, so we have a few people watching. I just wanted to reach out to you guys and say now is the time to, if you have any burning questions, go ahead and type that in the comments and we'll have Ruth and KP answer them. I'll, just give you guys a couple minutes to think about that. And while you're doing that, KP and Ruth, if somebody were to, be on the fence about being on semaglutide, what would you tell them?
I think that it's a really personal decision. We all have probably struggled at some point in our lives with wanting to have a little bit of, control over our weight or eating habits or anything like that. I don't think that you should be hard on yourself or consider it a failure if you do the semaglutide program. It's a tool for us. It's not giving up. It's a tool. It's a really good tool. It's diet, exercise, drinking water, getting your proteins in, and also taking semaglutide. If you have questions about it, Ruth and I were here to help walk you through this process. I'm more than happy to schedule a phone call and just answer any questions you have about your specific journey, your personal journey, and we can see if it's a good choice for you. It might not be the right choice for everybody, and that's totally okay. But if it's something you're looking into, I'm happy to help answer any questions.
And I agree with KP. The other thing that I like to say is, for the most part, this medication has been on the market as Ozempic for over 10 years. It's been researched for a longer period of time than that. And for the most part, it's very safe. There are some contraindications, certainly, and that's why we're here, to make sure that somebody is not starting a medication that may not be good for them. But, it's really a pretty safe drug with minimal side effects that are most likely annoying to most people than anything else. So I like to add that.
Yeah. I always, when I'm talking to people, I tell them we have to weigh your risk and your benefits. Same with any medication, any exercise program, any diet that you're doing. And we just have to see if it's the right choice for you.
Great. So for all of those folks who are watching this after the live, we are happy to continue accepting questions in the comments, and we will get back to you on those as soon as possible.
Yeah, I'm super excited. Thank you guys for joining us on our live today. One of the things I don't think we mentioned was how much does it cost, so I just want to touch on that real quick. Our program here at Rêvée is $499 a month. If you send me a message or respond to us on Instagram or Facebook, I might have a way to get you $100 off your first month. So that would make it $399, but it includes lab work because we want to make sure that everything looks great. It includes your visit with Ruth to go through all of your medical history and make sure everything looks good before we get you started. And it also includes all of your supplies for that month. So medication, all of those sharps containers, everything's pretty much done up and made really easy for you. So we are super excited to hear from you guys and hopefully see you soon. Please, please, please let us know if you have any questions at all. We are definitely here to help support you in your journey, answer any questions you have, whatever that may look like.
Absolutely.
We also have an opportunity for you to win 2 free months on semaglutide.
That's right, yes. 2 free months. It is part of our raffle basket. We are having a big end of summer party. If you haven't seen all of our posts about it, it is next Thursday. That's September 21st, 5:30 to 7:30. Is that right? We are raffling off thousands and thousands of dollars worth of prizes. 2 baskets, you do not have to be here to win. That includes the semaglutide basket. So 2 free months, $1,000 value. You can win that. Come on by. Everything that we are getting from these raffle tickets goes straight to Anna Julia Cooper School. If you don't know about them, there's tons of info about them on our website and on our Instagram and Facebook. Please come out and support them, and plus it's going to be a super fun, amazing time. So yeah, I hope to see you guys there. Bye.